Hi everyone, Julien here, nurse practitioner for Dan Aesthetics Medical, and today I just want to talk about cheek fillers. I think personally cheek fillers are one of the main contributing factors why people look overfilled. So let's get into that and let's explain my theory on it. So whenever people are getting their cheeks done, the first thing that I like to do is I want to identify any areas that have hollowed out. Most of the time the first place is going to be the mid cheek. This is the first place on the face where we tend to lose our deep fat, the soothe. And then what I do is I look at the lateral soothe or the lateral aspect of the cheek to see if the apex has dropped. So let's say we're going to treat a feminine face here. Take the lateral tip of the eyebrow, drop it straight down, upper area of the nose, upper tragus, cross it, and that's usually where you're going to find the link. If you feel that it's a little low, just look at the zygoma here. And if you feel that link is a little low, just bring it up. You want to be on the bone. You want to respect their anatomy. These are just reference zones. So if it's around here, then you just want to basically go on the bone and drop it straight, and you know it's going to be right around there, essentially. That's your apex. The apex means that's where the light reflex should hit. And what you want to do is you want to taper it up, and then you want to taper it down. And you do not want to over-exaggerate it. You just want to bring it back to maybe where they've lost a cheek, right? So most of the time whenever you're filling, you don't really want to change their face. Ideally what you're trying to do is just basically restore some lost volume. This makes it look natural, you're never going to overfill it, and it always looks great. And the key reasons why I don't like filling beyond that apex is for a few reasons. Number one, it doesn't usually look natural. People will tell you that if you fill beyond this ligament here, it's going to provide lift of the face. In my opinion, it doesn't. You may get a little lift that day, maybe from the manipulation of the tissue, but I assure you give it a week, it's not going to be lifted. You're just going to be stuck with a lot of volume there. That's what it does. It volumizes the region. So now you volumize this whole area here, and then all of a sudden you notice, wow, that temple looks hollow. Well, that's because you shouldn't have put filler here in the first place, but how you're going to correct it, you fill the temples. Smart on you. Okay, you fill the temples, and now the client comes back a few weeks later and they're saying, sheesh, from here all the way up, I look like it's unbalanced. This is too big now. Maybe it's the hollowing I have in my cheek. Can we fill that? Yeah, sure. You go ahead and you fill the hollowing in the cheek. And then voila, you've created a monster. Now this person's overfilled. And to make it worse, it's a possibility that whenever you place the cheek filler here, you've placed it in the superficial fat pads, not in the deep fat pads, but the superficial fat pads. I see it often enough. And 6 to 8 months later, these mobile fat pads, the filler moves down. And as a result, the cheek looks flatter and they just look bigger. They look like they put on weight. And the client comes in, they even say the same thing. I don't know, maybe it's COVID, maybe it's something. I'm not sure what's going on. I look like I put on weight. I know my cheeks, I lost it. Can you refill it? Yep, you can refill it again. You make that look great. You do the whole zygoma again, and boom. You've just accentuated your problem. And then you chase the temples and maybe even chase the hollowing again. Imagine, that's in 2 or 3 visits. Imagine over 5 years of constantly filling someone. This is why you have to really understand what looks natural and try and keep it natural. When you're doing the cheek, restore the areas that have lost volume only. Medial soothe, the apex, try and tie that in naturally together, taper it up slightly, taper it back, and that's it. And remember, this is your work. Even if it's trending at the moment, if you think this looks unnatural and you're potentially going to be ruining faces, don't do it. And if you can make sure that you're taking care of them for the long term, you're going to keep these clients and they're going to bring you a lot of other clients. So I hope this helps. I hope a lot of people keep that in mind whenever they're getting their cheeks done as well. Don't overdo it. Just highlight the necessary aspects and do it with taste. Till the next time, take care of yourselves, exercise daily, and please be nice to absolutely everyone. Take care.